I thank you all for tuning in to Aid Chicago Live. This is Charles Patton, your people's counselor, sitting in for Sister Yaa Simpson, the community epidemiologist, who will be here shortly. But in the interim, I just want to let you all know that we are here not only addressing the issue of HIV/AIDS in our community, particularly the African American community, but also on a nationwide or statewide level. But we also want to talk a little bit about health equities. This has been the paradigm in which we have been trying to address this particular scourge in our community and making sure that people of color are getting accurate treatment for the conditions that we are facing. A lot of times, when people get sick, unfortunately, they don't get the necessary care. And I personally have been, I've experienced that within my own family. You know, where I lost a sister due to a very treatable form of cancer who unfortunately didn't get the appropriate treatment that she needed. So health equities is an extremely important concept. And for those of you that are not familiar with what that really is, when we talk about health equities as opposed to equality, equality means that everybody gets what's known as a cookie cutter approach. You know, everything is pretty much standardized and you get what everybody else get. And a lot of times that's not what we need. Okay, so the reality of it is that we need to shift from equality to health equity, meaning that if you need certain tests or you need certain medications or you need certain screenings, okay, hey, look like we got a caller, okay, all right. Well, hello, caller.
Yes, sir. Good evening, sir. You know, what gets me is every week somebody is on that fine show of yours.
Okay.
A great show. And yet, all they have to do, cover up. And they don't want to do that. Then if they do catch HIV or AIDS, they don't want to tell nobody, you know, especially the next partner.
Yes.
So that's how it spread, because nobody wants to say anything. You know, nobody wants to say anything. Nobody wants to tell on anybody. So, but forget about that pill, because sooner or later it's going to be outdated, and it's not going to work anymore.
Well,
Please, all you have to do is cover up. Cover up, cover up. Thank you.
All right. Thank you, caller, for that, for your comment. And just in response to that, I do agree that HIV is 100% preventable and is based on what you do, not who you are. But we also know that there are several other factors that go into that. And we know that even 30 years into dealing with HIV, we are still dealing with a very serious issue called stigma. And unfortunately, that stigma is what keep a lot of people from talking about their condition because they get treated differently. And don't none of us want to get treated like we a leper or, you know, or something to that effect. So a lot of times they will keep it from their partners. I do agree with you that we need to encourage people to talk about and, of course, know their status first and foremost. You know, but there are certain things that must be addressed when it comes to the issues that's in the neighborhood that affects other folks and keep them from talking about the things that they need to talk about. But with that being said, I'm going to go to an overhead for a moment, and we'll let our community epidemiologist come in and address that comment. Oh, what is that at? Oh. Hold on 1 second. Okay, it's not, the slides is not up. Okay, there we go.
Very good. You got to know how to get the slides up. Thank you, counselor.
But he was talking about people not discussing their status. And
not discussing their status.
Yeah, that's why it keeps spreading.
So, hey, everyone. People not discussing their status. Well, thank you so much. My name is Yaa Simpson, Sister Yaa. Hi, everyone. How are you Oh, I am a community epidemiologist for TACTS, and I want to thank our people's counselor, Mr. Charles Patton, who was talking about people not disclosing their status. Well, let's be clear. It's like a checkbook. There's either money in or money out, whether you know what's in the account or not, right? Disclosing your status doesn't mean you don't have the disease. It just means you're not telling anyone about it. You should not feel discriminated against. And what we're really trying to prevent is stigma, meaning that you are ashamed of what you have as an infection or a disease. And you don't need to be ashamed about it. If you have an infection or a disease, you can tell someone that you feel who will listen to you or care about you. More importantly, we want to say, he who conceals his disease cannot expect to be cured. That's a very old ancient African proverb. And if you conceal your disease because you are ashamed or because of stigma, then we invite you to talk to someone so you can get out of that. I would like to also bring up to people what is going on in the United States as it refers to the legislation. I was on my way here, speeding up, right, to get here, to work with you all today. And they're talking about the repeal and replace of the Affordable Care Act, also known as Obamacare. And people, please recognize that if you think the healthcare system is not up to par now, it will be grossly subpar if this bill passed. To not be political about this, unfortunately, we don't have the luxury of not being political and talking to people about our legislative process, which is hurting us, especially those of us who don't have the resources like those who in Congress. Congressional people have universal health care. So when they tell you about Bernie Sanders and socialism, please push back and say, well, give up your health care because you have universal health care. Congress has a form of socialist health care because if you're a congressperson, you get your health care covered. No problems, regardless of how much you make. Your health care is covered. So what you want to tell them is, I want the same kind of health care that you're getting. Healthcare coverage comes with your job. I want healthcare coverage to cover me as well. Healthcare is a right, not a privilege. And they are privileged to even get it because they're Congress people. So I am encouraging you, even though we are TACTS, the Association of Clinical Trial Services, and we are a non-for-profit organization, we are, in some instances, we are activists and advocates of truth. We speak power to truth. And the truth is, we need health care. We need health insurance. We need health assurance and quality, affordable assurance and insurance in this country. And it can be done. We've done it with Medicaid and Medicare. And we've done it with the military, with veterans, which I happen to be a veteran as well. I know I don't always talk about being a veteran. Yes, I know that. But I am a veteran. And I, too, have a form of health care that is somewhat covered. I have to pay premiums. But the bottom line is, I know I can go somewhere and get care if I need it. So we do need to talk about Medicaid, Medicare. We talk about veterans' health, Native Americans on different reservations, and more importantly, you as Congress people. They receive a form of health care that is not dependent on their incomes. So you should receive the same exact privilege or, right as they have received. So I hope that works into the idea that we're talking about what's happening with our legislators. Today, I want to make sure that we always go over, what we're always working with is diversity, and we're always talking about how this plays a role in what we do for tax. And of course, I am always speaking on, as you can see, health equity. Now, health equity, as you know, I've consistently talked about this, is making sure we get what we need when we need it. And in this particular triangle, you see health equity as being the focus point of healthcare. And we look at programs and services and data and research, but in the middle of all of that is health equity. And so we want to make sure that we're always looking and thinking of health equity for us. Now, one of the things I want to make sure people get is what equality is versus health equity. And I notice some people don't get this, but equality is when people are the same across. And in healthcare, we can't do that because we have people that are taller, people that are smaller. And that means everybody isn't getting the best health. But equity is the boxes that give you where you can all look over the fence and see the home runs being played, especially for you Cub fans, right? You can look over that fence and you get the resources that you need. That is the difference between equality and equity. Equity is about getting what you need. Equality is just sameness and fairness. And there's a place for that, but unfortunately in healthcare, we need the resources for those who are most impacted compared to the resources that are maybe not as needed for those who are less impacted, like those in Congress, who can afford high premiums and insurance payments, and those who are on, who cannot even, for those who cannot even get Medicare, when your income is just a little too high, you would need that extra box, unlike the people in Congress. So I'm going to start making that the example of equity. We're going to work on that, right, Counselor? If you would like to call for some more questions or understanding, call TACTS, the Association of Clinical Trial Services. You can call us here at 312-738-1060. This is a call-in live, and we want to make sure that people know that they can also see this on the web if they went to the website. So again, this is a concept of what we're working with today is on the Illinois advances the abortion bill of HB 40. So why am I bringing that up? I'm bringing that up because legislation. As an epidemiologist, my job is to study and talk about infectious diseases. I specialize in infectious diseases, and I look at the trends, I look at the incidence, the prevalence, all those things. And then I provide the data and I support it with evidence. That is what I'm doing. I provide an evidence-based platform for any illness. That's what I'm supposed to do, the research, the data, and all that goes with it. But who am I providing it to? You all! I hope so. We'll find ways for you to get that data, but more importantly, your legislators. Why am I bringing this up? So I talked about the Affordable Care Act, but I really wanted to focus today a little bit more on what we're calling the Illinois, it's called the Illinois House Advanced the Abortion Bill. It's HB House Bill 40. And why am I bringing this up? Because in May it did pass, and I know that abortion issues are controversial. I know that. But to say we can't talk about it is incorrect. We have to talk about this bill only because it passed and I didn't hear much fanfare about it. And I thought it was an important topic for women's health. And let me be clear, this is a family health issue. I understand how some people may feel what they think is right or wrong about abortion, but in the end analysis, as public health, we see it as a public health issue, not as just a moral derivative of which some people have taken up, moral, or even they would call it religious. Regardless of how they think about it, this is still a public health issue. So what are the tenets of this House Bill 40? Abortion remains legal in Illinois. I know you're like, what? Well, let me be clear that what would have happened had they not done this bill. If so-called the Supreme Court overturns Roe versus Wade v. Roe, right? If they overturn the abortion bill, it would have an impact on how states operate, whether abortion is legal or illegal. If that bill was to be overturned tomorrow, if House bill for Illinois wasn't passed and the Supreme Court overturned the Roe versus Wade, then abortions would automatically become illegal in the state of Illinois. So to prevent that from ever becoming an issue, ever, at least as far as these legislators are concerned, they did do something good, and they passed this bill. So if that was to happen for any reason, especially with the current administration in office, Illinois would be protected and always would have a legal standing for abortions. Now, again, this is not based on just a moral imperative, but it is based on a public health imperative. That way women who want and need those services can do it legally. And I also want to bring up one of the other points, that it also safeguards against discrimination practices for Medicaid recipients. I have to mention this because it has been found that people who are receiving Medicaid, that's the one where's aid to those who are disabled or for some reason are not able to get, they're indigent and not able to have any type of income or very little to low income. They were being women were being discriminated against if they were on Medicaid and could not use the Medicaid benefits for an abortion. And in public health, you have to be able to use your benefits for all things public health, including women's reproduction rights. Women have the right to fair, equitable, good quality service for their reproduction systems. And that is a part of possibly having to abort a fetus. Now, again, this is not the moral imperative, this is the public health imperative. And in public health, we may not agree on people's choices. I don't agree with people who smoke. That's an inside one. I don't agree with people who smoke, but I will not deny them services if they need it, because unfortunately they may have developed cancer and now they need treatment. So that's what I mean by public health. Hey, I got a caller. Welcome to the Tax Call-In Live. May I help you?
Yes, may I suggest that if the abortion bill passed, and I think it's a wonderful bill because it's necessary, but for the AIDS problem, may I suggest that we work harder to get the bill in and to get it passed? It is necessary. There are too many people that need it.
Okay, which bill are you referring to?
I want any bill that stands. I want the one for AIDS to be worked toward being passed.
Okay. Well, thank you, Miss Freddie Flowers. I appreciate that, Auntie. Y'all, that's my auntie. I recognize her voice anyway. Thank you for calling in. That means she's watching her niece. But let me address her issue professionally first. So she's referring to making sure that people who have HIV infection, who may develop to AIDS, because Auntie goes the AIDS, but we know that is HIV infection. First of all, Aunt Freddie. The second thing is the bill has passed on that. What you're referring to is getting to zero proposition. The getting to zero proposition actually just happened yesterday in the city of Chicago with the AIDS Foundation of Chicago, with a few other community-based organizations, as well as Chicago Department of Public Health, the Office of LGBTQ, and others. The commissioner just had a meeting on how to talk about getting to zero, meaning no new HIV infections in the city of Chicago, period. within hopefully next few years. I'm not sure what the exact benchmark is, but we throw things out like hopefully by 2020 or 2025 we will have 0 new cases. In fact, we can do that before 2020. That would be the best auspice for us. Can we get to 0? Meaning no new infections within the next few years, okay? So right now it's about 900 new infections per year. Among black people or African Americans, it's about 700 per year on average for the last 5 years. What they want to say is no brand new cases as we go through the years. Again, I'm not sure of the benchmark, but let's just put it out there. I'm going to say by 2020, let's say 2025, can we have 0 new infections? Now, that is a tall order. But how do we get to that point? Well, we get there by people, first of all, if you're HIV positive, you don't spread it to someone who's not HIV positive. If you're not HIV infected, then don't become infected by using condoms or, i.e., other preventive tools like PrEP, which is pre-exposed prophylaxis. Those are the 2 ways that we know that you can prevent HIV from spreading. So what my aunt is referring to is this big press release that went out. It talks about getting to 0. As far as bills are concerned, we do have rights for legislations for people that are living with HIV, but what we're talking about is preventing HIV from continuing to spread. It has gone down, though, people. That is good news. HIV has decreased in the city of Chicago, but it is not to the point where it is 0. So I just wanted to make sure that we touched based on some healthcare issues. House Bill, again, 40 is important. If you want more information, please see here. It says Personal PAC. PERSONAL PAC, PAC.org. You can go there for more information on the House Bill 40. That's where I got my information. In fact, that's where I read it from. I was reading this wonderful magazine. It's called Chicago Women Magazine. I'm giving it a little plug, and they have this article in there, and hopefully we'll be doing more business with them. I want to appreciate my Vice President of Tax, who is the People's Counselor. Give it up for Mr. Charles Patton. He came in today to help out, and look forward to doing another session with us next month where we will be addressing the opiate epidemic. Again, I am Sister Yaa, your community epidemiologist, and we hope to see you soon. Call us up. If you want to personally call, you can call 312-961-6189 or call CAN TV at 312-738-1060. Thank you so much, and I look forward to us passing great legislation. See you.